Welcome back, everyone, for another deep dive. This time, we're going to be talking about surgical prophylaxis.
Ooh, exciting.
Yeah, it's pretty important, wouldn't you say? Especially for our listeners, all you medical microbiologists out there.
Absolutely. It's definitely a cornerstone of patient care.
Totally. And to guide us through this deep dive, we'll be using the WHO's AWARE publication.
Oh, yeah. Access, Watch, Reserve. Great resource.
It really is. And we're going to be focusing specifically on the chapter on surgical prophylaxis. It's packed with information on how to prevent surgical site infections, those pesky SSIs.
Can never be too careful with those.
For sure. We'll be talking about some interesting stuff like how SSI rates can vary so much around the world, and even the debate on how to approach prophylaxis for patients who have, those multi-drug-resistant organisms.
Sounds like a lot to unpack. I'm looking forward to it.
Me too. Let's jump right in. So, first things first. Can you give us a nice, clear definition of what antibiotic prophylaxis actually means when we're talking about surgery?
Well, according to the WHO, it's the prevention of infectious complications by administering an effective antimicrobial agent before exposure to contamination during surgery.
So basically, it's like we're setting up a defense, right? Before the enemy, those microbes, can even get a foothold during the surgery.
Precisely. Trying to stay one step ahead of those little invaders.
I like it. Be prepared, as they say. But, this source doesn't really go into much detail about what an SSI actually looks like clinically. For our medical microbiologist listeners, what should they be on the lookout for?
Good point. The source is really focused on the preventative side of things, but recognizing a potential SSI is obviously crucial too. And I think the first step there is understanding the different types of surgical wounds.
Oh, right. Like, not all wounds are created equal when it comes to infection risk.
Exactly. So you have your clean wounds, which are the most straightforward. No inflammation, not involving any, messy areas like the respiratory or digestive tract. A simple closed incision would be a good example.
Okay, so those are the low-risk ones. What about the less than clean wounds?
Right. So then we have clean contaminated wounds, which do involve those systems I mentioned, but the surgery is really controlled, so contamination is minimized, like a carefully done appendectomy, for example.
Gotcha. Bit more risk involved there. What else?
Then you have contaminated wounds. These are your open wounds, accidents, or surgeries where, maybe sterile technique was compromised somehow. Think about a bowel perforation during surgery.
Yeah, that's definitely higher risk.
Definitely. And lastly, you have the dirty or infected wounds. These are typically older wounds with, an existing infection, like a ruptured appendix, for instance. The microbes are already there before the surgery even begins.
Okay, so that gives us a pretty clear picture of the different levels of risk. Now, what about lab tests? What should a medical microbiologist be thinking about when it comes to surgical prophylaxis?
Well, the source really leans into the prevention side of things, like we said. But there are two main areas of lab testing to consider. You have your microbiology tests and then other relevant lab tests as well.
Makes sense. So starting with the microbiology tests, what's the main goal there?
Basically, it's all about identifying the usual suspects, figuring out which pathogens are most likely to cause an SSI. And that's where knowing the specific procedure is really important.
Right, because different bugs like to hang out in different places.
Exactly. And Table 40.1 in the WHO source is super helpful for this. For example, we know that Staphylococcus aureus is a big problem in cardiac procedures.
Oh, staph, that's always a troublemaker.
Right. And then you have those pesky anaerobes, especially Bacteroides fragilis, that often show up in bowel surgeries. So knowing what kind of surgery we're dealing with helps us narrow down the microbial lineup.
Like tailoring the investigation based on the scene of the crime.
I like that analogy. And what about those other lab tests you mentioned?
Right. You mentioned other lab tests besides the microbiology ones. What are those all about?
Yeah, so those are kind of like our extra tools in the detective's kit, Things like a white blood cell count, C-reactive protein, and of course, the wound culture itself. Super helpful for diagnosing and managing SSIs, even though the WHO source doesn't explicitly talk about them.
Okay, so it's like getting a more complete picture of what's going on. And what about imaging? Does that play any role in surgical prophylaxis?
Imaging is more on the diagnostic side than the preventative side, really. We don't typically use it for prophylaxis itself, but it can be a huge help when we need to visualize those deeper or more complicated SSIs, the ones that might not be so obvious just from looking at the patient.
So it's kind of like our specialized tool. We break it out when we need a closer look.
Exactly.
Now, even with the best laid plans, sometimes infections still happen. Let's shift gears and talk about treatment for a bit, specifically antibiotic treatment. The WHO source goes into a lot of detail on this. What are some of the key takeaways?
Absolutely. Table 40.2 in the source is like a treasure trove of information on different antibiotic regimens. It breaks down the first and second choice antibiotics for a whole range of procedures, gives you dosages for adults and children, and even highlights specific considerations for different types of surgeries.
Wow, that's super helpful. Can you walk us through a couple of examples?
Sure. So cefazolin, that's a real workhorse antibiotic. It's used a lot for clean procedures. But when we're talking about bowel surgery, we often pair cefazolin with metronidazole, to target those anaerobes we were talking about earlier.
Okay, because they love to hang out in the gut.
Exactly. And then there's gentamicin. That's a powerful antibiotic that's often added in for those contaminated procedures, or if we think there might be resistant organisms involved.
So it sounds like choosing the right antibiotic is a real art. There's no one-size-fits-all approach.
You got it. It's about carefully weighing the risks and benefits, taking into account the specific surgical site, the patient's individual situation, and of course, the potential for resistance.
And I imagine the duration of antibiotic treatment is also really important. Is there like a general rule of thumb for that?
Yeah, the WHO is very clear on this. In most cases, a single preoperative dose is enough to cover that period of potential contamination during the surgery. Using antibiotics for longer than that, well, it doesn't really give you any extra benefits, and it can actually increase the risk of resistance and other complications.
So it's about striking that balance, huh? Preventing infection, but also not going overboard with the antibiotics.
Exactly. It's all about finding that sweet spot, which is why, like you said earlier, staying up to date on these guidelines is so important.
Absolutely. Now, I'm curious about the mechanics of all of this. What's actually happening at a cellular level that allows these SSIs to develop in the first place?
That's where pathophysiology comes in. Think about it. Whenever we perform a surgery, we're disrupting the natural barriers of the skin and tissues, right?
Yeah, kind of creating a weak point.
Exactly. And that creates an opportunity for microbes to slip in and potentially set up shop.
So it's like opening a door for those little invaders.
Pretty much. And once they're in, things like biofilm formation and the interaction between the microbes and the host's immune system, those all come into play too.
Ah, biofilms, those microbial fortresses, always making things more complicated.
Right. They're definitely a key player in SSI development. Understanding how they work is essential for both prevention and treatment.
This is all fascinating stuff. But, the source also mentioned something about how SSI rates can vary quite a bit around the world. I'm really intrigued by that. What did the WHO find?
Yeah, the epidemiological side of this is really interesting. The WHO's data shows that there's a huge range in SSI rates, even within Europe, depending on the procedure. Like knee prosthesis surgery, that has rates as low as 0.5%. But colon surgery, that jumps up to 10.1%.
Wow, that's a big difference. I wonder what drives that kind of variation.
It's likely a combination of factors: surgical technique, the patient's overall health, even the specific types of microbes that are more common in different regions. But interestingly, the WHO report also found a link between a country's Human Development Index, the HDI, and its SSI rates. Countries with lower HDI scores tend to have much higher rates of SSIs.
Makes you think. Probably a lot of factors at play there. Resources, sanitation, healthcare infrastructure.
For sure. It's a complex issue. And this source definitely raises more questions than it answers. But that's what makes this feel so exciting, right?
Totally. Always more to learn. Speaking of learning, can we circle back to those most likely pathogens for a second? The WHO source really emphasized how important it is to know which microbes are, the top offenders for different surgical settings.
Absolutely. Table 40.1 is our guide for that. We talked about Staphylococcus aureus and how it's a major player in a lot of procedures, especially cardiac surgery. And we know those anaerobic bacteria, like Bacteroides fragilis, are often involved in bowel surgeries. But there are other culprits to be aware of too. For instance, in head and neck procedures, you have to worry about the whole diverse oral microbiota. And in gynecological procedures, group B strep is a big concern.
So it's like each surgical specialty has its own set of microbial bad guys to watch out for.
Exactly. Knowing who they are is crucial for choosing the right preventative measures.
Okay, I feel like we've covered a lot of ground here. But how about we test our knowledge a bit? I've got a few exam-style questions based on what we've talked about so far. Ready for a challenge?
Bring it on. I love a good microbiology quiz.
All right, question number 1. How does the World Health Organization define surgical prophylaxis? No peeking back at the source material.
Haha, no cheating. All right, everyone, think about that definition. We'll be back in a moment to discuss the answer and maybe delve a little deeper into some of the nuances. All right, so that definition. Surgical prophylaxis, what is it? Well, the WHO defines it as the prevention of infectious complications by administering an effective antimicrobial agent before exposure to contamination during surgery.
That's it. Gotta love a good, clear definition. All right, ready for question number 2?
Hit me with it.
Okay, picture this. You're about to perform a laparoscopic cholecystectomy. What type of surgical wound would you classify that as? And more importantly, why?
Okay, laparoscopic cholecystectomy. Let me think.
Remember those wound categories we talked about? Clean, contaminated, and dirty or infected? What makes this particular procedure unique in terms of infection risk?
Right. Laparoscopic. Biliary tract. Okay, I've got it. It would be classified as a clean contaminated wound.
You got it.
Even though it's laparoscopic and minimally invasive, we're still entering the biliary tract.
And the biliary tract.
It's not as, full of bacteria as the bowel, but it's not sterile either.
So there's still that risk of introducing some unwanted guests into the surgical site.
Exactly. And that's where choosing the right antibiotic prophylaxis comes in. Got to have those defenses ready.
Speaking of antibiotic selection, let's move on to question number 3. According to the WHO, what would be the first choice antibiotic for a hysterectomy?
Hysterectomy. Oh, okay.
Don't forget the dosage. Those are important.
Right. Let me just refresh my memory on that table. 40.2. It's all in there.
It is. Take your time, no rush. We'll be back in a sec with the answer.
All right, I think I've got it.
Let's hear it.
For a hysterectomy, the WHO recommends cefazolin as the first choice antibiotic.
Spot on.
2 grams for adults, 4th IV administration.
Don't forget about our pediatric patients, though.
Of course. The dosage would need to be adjusted for kids based on their weight. Can't be giving them the same dose as a grown adult.
Safety first. Now, let's move on to question number 4. This one's about timing. When should we ideally be giving that antibiotic prophylaxis before surgery?
Timing. That's a good one.
Think about why that timing is so important. We want to make sure we're maximizing that protection, right?
Right. We want that antibiotic to have reached the tissues, to be at the right levels when the surgeon makes that incision.
Exactly. We'll be back in a jiffy with the answer.
Okay, I'm ready. The ideal timing is within 60 minutes before the incision.
You nailed it. 60 minutes. It gives the antibiotic enough time to reach those therapeutic levels in the tissues, providing that crucial protection right when it's needed most. Now, our final question. This one builds on that concept of timing. How long should we continue antibiotic prophylaxis after surgery for something like a hip arthroplasty?
The duration question. A bit of a tricky one.
Remember what we discussed about the WHO's stance on prolonged antibiotic use? More isn't always better, right?
Right. The WHO is pretty clear about wanting to avoid unnecessary antibiotic use. Let me think.
We'll be back in a bit to see if you got it right.
All right, here's my answer. For a hip arthroplasty, the WHO recommends against continuing antibiotic prophylaxis after the surgery is over.
You're on a roll. That's absolutely correct.
That single preoperative dose, if timed correctly, should be enough to do the job. Keep those SSIs at bay.
Exactly. Using antibiotics for longer than necessary doesn't really add any benefit, and it can actually lead to some nasty complications.
Oh, yeah. We don't want to mess with the patient's normal microbiome. That can open the door to all sorts of problems, like antibiotic resistance and C. diff infection.
And those are definitely not things we want to see. So it's a delicate balance, isn't it? Preventing infection, but also being mindful of the potential downsides of overusing those antibiotics.
Absolutely. It's about finding that Goldilocks zone. Just right for each patient and each procedure.
Couldn't have said it better myself.
Yeah.
Now, for our final exam question, picture this. You're looking at a wound culture from a patient who's developed an SSI after a colon resection. What microbe immediately pops into your head as the most likely culprit?
Colon resection. SSI. Thinking back to those usual suspects.
Remember, different bugs prefer different neighborhoods. Think about the environment of the colon, the types of bacteria that thrive there.
Right. Anaerobes. This one should be straightforward, if I remember my microbiology. We'll reveal the answer in a moment and talk about why this particular bug is such a common cause of SSIs after bowel surgery.
All right, time's up. Let's see if you got it. The usual suspect for an SSI after a colon resection is?
Bacteroides fragilis.
Ding, ding, ding. We have a winner. But why is this little guy, these Bacteroides fragilis, so often the culprit in these cases?
Well, you have to think about where it's coming from. The colon, right? It's like a haven for anaerobic bacteria.
Anaerobes love the gut.
They do. And Bacteroides fragilis, it just happens to be one of the most common ones hanging out in there. So even with the, best surgical technique, there's always a chance that some of those bacteria are going to end up in the surgical site during a colon resection.
Just a matter of opportunity, I guess. Well, this has been a really fantastic deep dive. We've covered so much ground. We started with the basics, defining surgical prophylaxis.
Yeah.
And then we went on to all those nuances, like the different wound classifications, the lab tests, how to choose the right antibiotics.
Even the global picture with the epidemiology of SSIs.
Right. It's really amazing how much goes into preventing and managing these infections. And I think it really highlights how important the role of a medical microbiologist is in all of this.
Absolutely. We're like the detectives of the microbial world, right? Always on the case.
That's a great way to put it. But, the WHO source also leaves us with this kind of lingering question, this challenge.
Yeah.
How do we tailor surgical prophylaxis for those patients who are colonized with, those multi-drug resistant gram-negative bacteria?
Yeah, that's a tough one. And to be honest, the source kind of admits that there aren't any clear-cut guidelines for those situations. It often comes down to a case-by-case kind of assessment.
Really weighing those risks and benefits for each individual patient.
Exactly. And it's definitely an area where we need more research, to help guide our decisions and make sure we're doing the best we can for those patients.
It sounds like this is where the expertise of a medical microbiologist really shines, having that deep knowledge of resistance patterns and all those different antibiotic options.
Oh, absolutely. It's about staying informed,
Yeah.
keeping up with the latest research, and also collaborating with the clinicians, working together as a team.
And advocating for responsible antibiotic use. We've got to keep those superbugs in check.
For sure. Antibiotic stewardship is more important now than ever.
Couldn't agree more. Well, a huge thank you to all of our listeners for joining us on this deep dive into the world of surgical prophylaxis. We hope you learned some new things. Maybe you even walked away with some new questions.
Yeah, and just remember, even those small things can make a big difference, like promoting good hand hygiene.
And following those WHO guidelines.
Exactly. Every little bit helps when it comes to preventing these infections.
Well said. Until next time, everyone, keep exploring, keep learning, and keep those microbes at bay.